My name is Denisha Brown. I'm a student family nurse practitioner. I will be performing your interview process as well as your behavioral assessment today, if that's okay with you. Okay, so let me just wipe my hands off. So tell me, Mr. Harris, what brings you into the clinic today?
I need to establish care.
Okay, Mr. Harris, do you have any kind of medical history that you're aware of, like a heart condition, diabetes, asthma, anything like that?
No.
Okay, have you ever had any surgeries?
No.
Okay, are you allergic to any medications that you're aware of?
No.
Are you allergic to any foods?
No.
And do you have any environmental allergies?
No.
Okay, are you taking any medications at all?
No.
Any over-the-counter medicines? What about any herbal medications or multivitamins? Anything like that?
No.
Okay. What about your mom and dad? Do they have any kind of medical history that you know of?
No.
Do you have any siblings?
Yes.
Do they have any kind of medical issues?
No.
Is your grandparents still living?
Yes.
Do they have any medical histories that you know of?
No.
Okay. Are you up to date on all your immunizations?
Yes.
Okay. Have you had the flu shot, or do you want to get that while you're here in the clinic today?
I want to get that while I'm here this month today.
Okay. Good deal. So tell me, Mr. Harris, what do you do for fun?
Play basketball with my friends.
You play basketball with your friends. Okay. Do you drink?
No.
Do you smoke?
No.
You take any kind of recreational drugs?
No.
Okay. Do you go to school?
Yes.
Where do you go to school?
UAB.
Okay. What are you majoring in?
Law enforcement.
Okay. That's very good. Very good. Good luck to you. Okay. Keep that up. Okay. Let's see. Do you work anywhere?
No.
And have you been in the military?
No.
Okay. Have you traveled outside of the United States within the last 6 months?
No.
Okay. All right. Well, Mr. Harris, that's all of the questions that I have for you right now. So now what I'm gonna do is the assessment part of this. Okay. So I'll ask you things, or either I tell you whatever I need for you to do before we start. Okay. So right now, since we've already gone over the interview, I know that your orientation is intact. Okay. So right now I'm just looking at your head. I'm looking at your head to make sure that it's symmetrical. I'm also looking to ensure that your head is the right size for your body, and it is. Also, I'm looking at you to see your posture. You have a good posture. You have a good build, okay? And as far as your hair is concerned, it looks like it's evenly distributed. I don't see where any infestations are just visibly, okay? So now what I'm gonna do is I'm just gonna feel in your head here, and I'm feeling for any kind of indentations, any nodules. I don't feel any rashes or moles or anything like that, okay? Does it hurt when I'm pressing on your head like this?
No.
Okay, good deal. All right. And so now what I'm gonna do is I'm just looking at your eyes, and what I'm looking for with your eyes is just making sure that they are also symmetrical. We want to make sure that the pupils are even, and want to make sure that they are both the same size. Okay. And what I mean by symmetrical, we want to make sure that your eyes are in line with your ears, and they are. Also, what I'm gonna do is I'm gonna utilize my pen light here, because it's going to tell me whether or not your pupil sizes are even, okay? I put my pen over there. Okay. So I just need for you to focus on the object in here. Open your eyes wide for me. And I'm going to put this pen light here, okay? And we're going to look for the constriction. Okay, constrict. Very good. We're going to do the same thing on this side. Open your eyes wide for me. All right, constrict. So your pupil's about a 3 on both sides, and that's good. And like I said, I don't see any kind of drooping or anything in your eyes. So now what we're gonna do is we're gonna look at your nose, and I'm looking at your septum. I see is there any deviation in your septum. I don't see anything. I don't see any drainage coming from your nose. I don't see any bumps or lesions or anything like that. Can I get you to hyperextend your neck just a little bit? And what I'm gonna do now is just look with my pen light to see if I see any abnormalities, and I do not see anything. I don't see any redness there. Okay, you can bring your head back down. Okay, now the next thing we're gonna do is if I didn't have a pen light, I could also use my my ophthalmoscope to look into your to your nose with my light, okay? Also, if I had my ophthalmoscope, I would utilize that to look into each eye. And with an ophthalmoscope, you want to make sure whatever eye that you're looking in, that's going to be the same side that you're going to hold your ophthalmoscope, okay? So if I'm looking on my left side, the ophthalmoscope will be in my left hand, and vice versa, okay? Also, right now, we're going to look at your ears. So right now, I'm just looking again for symmetry, making sure that they're even on both sides. I'm looking for any kind of nodules. I don't see anything. I don't see any bumps or anything like that. So now I'm going to feel down your ear. Does that hurt when I do that? I don't feel any obvious lesions. I'm going to feel back here at your mastoid process. We're going to feel that on both sides. Okay. And if we had an otoscope, what we do is we pull your peanut up here and pull it back. And we will look inside your ear and look at your tympanic membrane, okay? And we'd be looking for like a grayish, pearly looking color, okay? What we don't want to see is any bulging or redness or anything like that, okay? I don't see any drainage or anything coming from your ears, no earwax or nothing like that, okay? So now the next thing I'm going to do, I'm going to go ahead and feel your temporal artery right here, okay? Now I want you to clench your teeth together. I'm going to feel your temporomandibular joint here. Okay. And also I'm going to feel for your vestibular joint right in here while you're clenching. Okay, good. Okay, now the next thing I want you to do, I'm going to feel that your temporomandibular joint again. I want you to open, close your mouth. And what we're doing is feeling for any clicks again, right, or any abnormality sensations, okay? And we don't feel anything, that's good. Now what we're going to do is we're going to look into your mouth. If you open your mouth for me and these pens. Okay, so we're going to look at your dentation, looking for any cavities. We're looking for any redness, any lesions. Can you stick your tongue out? We're going to put your tongue to your left side, then again to your right side. Good, lift your tongue up. Okay, we're looking for any kind of lesions because up underneath your tongue is where cancer likes to hang out. Okay, we're going to look at your gums here. All right, everything looks good. So we're going to look at your soft palate and also your hard palate. Good. Okay, say ah, ah. And we're looking at your uvula, and that looks good. It goes up and down when you say ah, okay? So that's very good. All right, now what we're going to do is we're going to check your sinuses here. I'm going to press here. Does that hurt when I press?
No.
Press here. All right. Okay, good job. Now I need for you to open your eyes wide, close your eyes. Now I need for you to smile for me. You can open them back. I need for you to frown for me. I need for you to puff out your cheeks. Good job. Your facial nerves are intact, okay? Now we're going to check for accommodation, okay? I just want you to look straight at me. And I'm going to put this, bring this pen in. You just look at the pen, okay? Okay, so your pupils are equal reactive to light and accommodation is intact, okay? All right, so now the next thing we're going to do is we're going to check for your lymph nodes, okay? So you're going to check your preauricle here, postauricle, your occipital. Okay, we're going to check for your tonsillar, which will be right in here, your supramandibular, which will be right in here, your mantle, which will be right here, your anterior cervical chain will be right here in the front side, and then your posterior cervical chain will be back here on your back side, okay? All right, so now the next thing I want to do is I'm going to look at your neck. If you would, hyperextend your neck just a tad bit for me. I'm looking at your trachea. We want to make sure that that is midline. There's no deviation at all. You don't have to go back that far, okay? And then the next thing I want to do is check your carotid artery here, okay? So I'm just going to hold here. Okay, we'll do the same thing on this side. Okay, and now that I've done that, we're going to listen with the stethoscope. We're going to listen with the bail of the stethoscope for any bruise. Okay, good. All right, good job. Now, let's see. The next thing we're going to do now is I'm going to get you to turn your head this way. Now turn your head to this side. Lift your head up. Lift your head back down. Shrug your shoulders for me. Good job. Okay, I want you to hold your arms up like this. I'm going to push in and I'm going to pull out. All right, good strength. Great job. Okay, so now I'm going to check your brachial pulses here. All right. Okay, let's do supination and pronation. Very good. Okay, turn your hands back over for me. And I'm going to check your capillary refill. Here we're going to look at your fingers, make sure there's no nodules or anything like that. It doesn't hurt when I pull on your fingers. You have to really check your hands really well because they have a lot of bones in your hands, okay? And it doesn't hurt when I'm pressing. Capillary fill is less than 1. All right, now I'm gonna check your popliteal back here in this artery. Okay, let's check this one with this pulse in me. Here we go. Your posterior tibia here, both sides. And your dorsalis pedis right here. Good job. Nice and bounding. While I got you sitting here, Mr. Harris, I want you to take your this leg here, your left leg, and go down your right shin with that. Good job. And you'll do the same thing with that right leg down your left shin. All right, good job. Okay, now let's see. See if I can do your reflexes while you're sitting up here. You should hold your arm out for me right here. Just let it relax. Okay, good. Same thing here. Oh, good. That's a nice jump. Okay, now we're going to check your knee. And you just let it relax. Just relax it for me. Okay. Now this side, just relax. Okay. All right, good reflexes. Okay, so now what we're gonna do is I'm gonna go ahead and get you to lay back because I can listen. Let me listen to the back side since I got you sitting up there. We won't have you up and down like that, okay? So I'm gonna listen to the back here. You're gonna take a deep breath for me. Good. In and out. Out. In. Don't go too fast. Okay, we're gonna listen on this side. Arm up a little bit. Okay. One more time. Okay. Listen on this side. Arm up just a tad bit. Good. All right, now you can just relax here. Breathe. Breathe. And just listening to your long sounds here. Okay. Let me get you to lay back on the bed here. Okay, so now what we're gonna do is, I'm gonna lift your shirt up here. We're just gonna take a look. I'm sorry. Look at your abdomen, okay? And your chest area. And your abdomen, it is rounded, Mr. Harris. I'm looking for any heaves or any lifts, any surgical wounds, any open areas. I don't see any of that, okay? Okay, so now what I want to do is listen to your heart sounds while I got you laying down here, okay? So we're going to listen to your aortic. It's going to be here in your second clavicular intercostal. And then your pulmonic is also a second intercostal space. You're gonna go to Erb's point, which is your third intercostal space. Then you're gonna go to your tricuspid, which is your fourth intercostal space. And then you're gonna listen to the mitral valve, which is your fifth intercostal space, and it should be midline. Okay. And also, this is where your point of maximum interest will also be. Okay. So we'll listen here for a moment, just 1 minute, and count the apical pulse. Alright, and also we're going to go back with the bell of the stethoscope. No same landmarks, listening for any rubs or any friction. Listen to the aorta. Turn that around, sorry. Okay, good. Listen to this way. Okay, now we're going to listen to your vowel sounds. You got hyperbowel sounds. Your pulse rate was 72, by the way. Okay, then we're going to listen to your iliac artery on both sides, and your femoral artery on both sides. Okay, then we're going to listen with the bell. Okay. Alright, now the next thing we're going to do, we're going to palpate your stomach, okay? So liver on this side, you got your spleen, your stomach here. Any pain when I'm pressing on your stomach. Okay, we're going to go a little deeper. Let me know if you're feeling any pain when I do this. No pain at all? Okay, so now we're going to percuss. We're just listening for tympanic sound. Okay, and then right over here where your liver is, it's supposed to sound a little dull, okay? I noticed that you have a little gynecomastia. Does that run in your family, or do you know? You know what that is? This is where it appears like you have some extra breast tissue here. Does that run in your family? Okay, so now what we're going to do is I'm going to get you to go ahead and hold your leg up for me. Then back down. This way too. Up. Then back down. Good. Now we're going to take this leg out. Bring it back in. Good. Bend it up. Bend this leg up. We're going to hold it out to this side. Back in. All the way. Okay, good. Now let's do the same thing. I want you to bend this leg up. Bring it in. Back out. And back down. Very good. Now I want you to press on my hands like you're pressing on a car. Okay? Good, good, good. Good strength. All right. Now I want you to sit up for me on the side of the bed. Well, not that. Not like that. I'm sorry. Because I need to do your chest expansion. So turn your legs back. Let you bend over just a tad bit. There you go. I'm going to hold this up. And I'm going to need for you to breathe real deep from it. Good, good chest expansion. Okay, now when I'm going to hit your back here, and I need for you to say 99 for me, okay?
99. 99.
Uh-huh.
99.
Uh-huh.
99.
Good.
99.
Checking for any infirmities.
99.
All right, good job. Good job. Okay, back here, does it hurt at all when I press here right in your kidney area?
No.
No? Okay, good. All right. Now I'm gonna get you to stand for me, okay? If you come out and stand for me. Go out on this side. Step right over there.
20 minutes.
Okay. So now what I need for you to do is just turn around right here. Okay, I want you to just bend over just a little bit. And what I'm doing now, I'm checking the curvature of your back, okay? And I'm just looking at your spine to make sure that everything is in alignment, okay? And from what I can see, it is. Okay. All right, everything appears to be in alignment. Okay, you can stand back up. All right. Now, I want you to do the things that I do, okay? You can just be like that, okay? I want you to take your legs up and down. On this side, up and down. Out and in. Out and in. And then up and down. And up and down. Now I want you to invert your feet. Back. Okay, this same, invert your feet. Then back. Can you not hold it up, baby? Can you hold that leg up? There you go. That's what I wanted to see what you do that side too. Okay, good job, Mr. Harris. You can sit down. I think we've checked everything. It looks like your assessment looks pretty good to me. You got any questions about anything?
No.
Okay, I thank you so much for allowing me to do your assessment today, okay?
Thank you.
All right.